Perfect. So good afternoon and welcome to the Brainy Boomer Lecture Series. We're so very happy that you guys have all joined us today. In 2007, the McGill University Research Center for Studies in Aging, or the MCSA's Education Committee, started the Brainy Boomer Lecture Series in order to suggest practical steps to both improve and maintain brain health, as well as to promote healthy lifestyle choices amongst the most populous generation in history. The MCSA Education Committee, which was founded in 1996, has three main objectives: identifying education needs of healthcare providers, seniors, caregivers, and the public, and developing responses to meet some of those needs; enhancing the image of the aging process by addressing some of the stereotypes and myths about aging; and finally, the dissemination of research on aging. Our lecturer today has a professional background that encompasses the development of social and community projects in both the public and private sector. Teresa Anuza is currently responsible for the content and analysis of conferences and trainings for educational services at the Alzheimer's Society of Montreal. She has been responsible for conferences developed to be presented to caregivers of people living with dementia, the public, and for institutes of higher learning. Ms. Anuza has also developed and delivered a series of training workshops for the professional healthcare community. She has represented the Society on numerous occasions at professional speaking engagements and community and media events. Ms. Anuza has been associated with the Alzheimer's Society of Montreal for close to a decade in a variety of roles, using her experience as a counselor, coordinator, and trainer. Before continuing, we would just like to remind you to please mute your microphone on Zoom. And if you have any questions, wait until the end of the conference, or you could write them in the chat box on Zoom. And now for the moment we've all been waiting for, I present to you Teresa Anuza with Ambiguous Loss and Grief.
Hello. Thank you, Caitlin. That was a lovely introduction. I'm very pleased to be here today. The topic that I'm going to be discussing is rather heavy for a lovely Saturday sunny afternoon, but I don't want to add to anyone's burden at this time, but my goal really is to normalize this very common process and to underline the importance of people having the opportunity to name, explore, and understand the grief they may be experiencing. I work for the Alzheimer Society of Montreal, so my focus and my examples will be on people living with the neurocognitive illness and their caregivers. But I want to be clear that we can all experience ambiguous loss and grief over many situations in our lives: a divorce, the loss of independence that many people are feeling as a result of restrictions due to this COVID-19 situation. So ambiguous loss and grief really affects everyone, but people don't know very much about it and they don't know how to recognize it. This conference is meant primarily to help caregivers gain a better understanding of how loss and grief can affect them and the person with dementia. It can also provide information to help people with dementia deal with their own losses and grief and to live as well as possible with the disease. Dementia is a fatal, progressive, and degenerative disease that destroys brain cells. It can go on for years, anywhere from 7, 10, 20 years a person can live with this disease. So whether you're caring for a spouse, a parent, a friend, a caregiver may experience losses and grief in different ways at all the stages of a neurocognitive disorder. During this conference, we will discuss useful strategies and tips to help you cope with the multiple losses and grief that you may be experiencing, and to stay connected with the person that you're caring for while remaining healthy and resilient yourself. So our objectives today is, number one, to recognize what ambiguous loss and grief is in yourself and in others. Secondly, to normalize ambiguous grief. And what I mean by that is to accept it as part of your life and to talk about it with others. And thirdly, we're going to try and build some life strategies so that you'll be able to move forward in your life. So we tend to associate grief with death. And as a society, we've developed certain rituals and practices that normalize the process of mourning when someone we love has died. These help people find the support they need and to move beyond their grief. So every society, every culture has some kind of rituals associated with grief. But when we're talking about ambiguous grief, we'll see that we don't have um, those tools. So grieving is a universal, natural, personal, necessary, and often complex result to many types of life events. A loss is a broken psychological bond with something we value. We grieve many things, big and small, throughout our lifetime. We experience loss and grief even in response to life events that can be quite positive. For example, a change in employment or working from home. A change in employment is generally taken as a positive move, but there's part of us that may grieve over the loss of friends, of colleagues, that we say we will stay in contact with them, but again, the bonds become more and more tenuous. And again, everybody will respond differently. Grief, loss, everybody experiences it in their own way. It's a deeply personal experience. Some people will get over it in a few days, other people will take weeks or months, but no two people will experience grief in exactly the same way. When we're talking about ambiguous loss and grief, here often it's referred to as leaving without goodbye or goodbye without leaving. In the case of neurocognitive diseases, such as Alzheimer's disease, the person is still physically here, but may not be mentally or emotionally present in the same way as before. They're different. Yet it's important to remember that the person with dementia, regardless of their abilities, still maintains a core of self that we know can be reached at all times, at all stages of the disease. And I'm gonna keep repeating this throughout the conference because it's an important point, and very often we forget that. We think, oh, well, I've lost that person is gone forever. And really, if we think about it, if we work on it, we can find that core of the person that's still there. Ambiguous loss is different from the loss and grief of death because closure is not possible. And your grief cannot be fully resolved while the person is still alive. But this ambiguity and the mixed feelings that it can stir up are a common and expected experience for caregivers of people with dementia. And this is what isn't clear. People don't understand. Sometimes there's this wave of sadness or sorrow that can hit a caregiver or even a person with dementia, and you don't know what caused it. What suddenly you feel very sad, very as if there's a hole left in you. And this is grief. This is what you may feel when you lose someone that's close to you. And with dementia, you're losing the person slowly, piece by piece. But this, again, it is natural. You have to expect this in what you're experiencing as a caregiver. And though we're talking about ambiguous loss and grief in the context of dementia, it's not unique to dementia. As I mentioned before, there could be situations where the person may be physically absent, but psychologically present. For example, with divorce, you're separated from your spouse, but there's still a psychological connection that you may feel grief or loss at some point when you have to reach a decision that normally you would have made with your spouse. So there's that sense of loss. The same with immigration. People that come to a new country, they may be happy here and things are going well and they realize it was the right decision, but there's still a part of them that grieves for their home country from where they came from. And on the other side, we have this, a person could be psychologically absent, but physically present. And this is where we have mental health issues, where the person is physically present, but psychologically they may not be. We see this in cases of addiction also. So the absent quality of a person who is still physically present distresses even healthy and resilient individuals. Ambiguous grief applies even more to those who are psychologically attached to the person experiencing the losses because of loss of the reciprocal relationship and a clear identity. In every relationship, there's give and take. It's a reciprocal relationship. And especially it could be a couple that's been married for many years. They can almost finish each other's sentences. They know what to expect from the other person, and this is changing. And it's hard to accept that and recognize it. It can be very painful. So these ambiguous losses add an extra element of complexity and even confusion to an already difficult situation in caregiving. In addition, these feelings are frequently not recognized or acknowledged by family caregivers and even healthcare professionals. Yet, ambiguous grief can follow the same stages that were recognized by Dr. Kubler-Ross many years ago, and that's denial, anger, bargaining, depression, and acceptance. The difference with ambiguous grief is that you continue going through this process. When somebody dies, you can have closure. You go through these steps, but then eventually it finishes. It's different for every person, but it finishes. While when you're a caregiver looking after somebody with a neurocognitive illness, it goes on and on. Even if you go through all these stages for one loss, another loss, you start experiencing another loss and then another loss. So it becomes very difficult and very wearing. But there are certain points where it's more noticeable. Like you can feel this grief or loss at any time, but sometimes it becomes more acute. And very often it's when you first notice the symptoms of the disease, such as Alzheimer's, either in somebody that you love or care for, or yourself. For example, the loss of words, forgetting appointments. You feel the loss. There's a grief there. Oh, I used to be able to do this. Why can't I do this now? Or he used to be able to do the crossword in 10 minutes. Why is he taking all day to do it and not finishing? So you start feeling the losses and grief right at the beginning. And with the diagnosis, again, life seems to change. And this could be a diagnosis of any illness, really. And also the loss of future plans. With Alzheimer's disease, it most often affects people over the age of 65. And at 65, it's retirement age. There could have been a lot of plans for the future. Oh, I've worked all my life. Now I've saved a little bit. Let's move to the country. It doesn't become a reality because of all the appointments that have to be made, that the person requires more help. Or it could have been travel plans that were made. Oh, we're gonna really travel now, and of course those dreams, those plans disappear, and we grieve their loss. And also, it could be when independence becomes restricted. We notice this most often in people when they lose their driver's license. That's a real loss. It's a loss of independence. It's almost a loss of identity for some people. And then we see changes in relationships. You may become a parent to your parents or your spouse. And friends, the relationship changes with friends. They don't come around so often. You don't have time to visit with them that often. And you may require outside help for tasks. So you have to start relationships with outsiders who come in, anything from mowing the lawn to grocery shopping to helping a family member to bathe. So these are all changes in relationships, changes in the life situation. And this can cause loss and grief. And here we have a testimony from a caregiver. This is from Alzheimer's Canada. They collected some testimonies. And it says, the word ambiguous helped me understand what was going on. I'm still married to my wife. I love her, but I don't live with her. I've always been crazy about her and still am. She's after her, but it's a huge loss for me. The ambiguity is exactly how I feel. So again, it's she's there and the person loves her, and yet at the same time, it's not the same person. The ambiguous loss, it complicates grief. It may be hard also for a caregiver to recognize this grief and know how to grieve when the ambiguities of the person with dementia have changed and the abilities of the person with dementia have changed. Family and friends may not recognize the caregiver's need to grieve the many issues that are experienced at different stages of the disease, and therefore not provide the caregiver with the support that the caregiver may need. You may need to carry on with caregiving. So ambiguous loss also confuses relationships and prevents moving on sometimes. For example, you may feel as if you are no longer in a marital relationship if your wife no longer knows who you are, yet your wife, regardless of her abilities, is still a whole person who can be reached at all stages of the disease. She's still there and she wants to communicate, but she may be unable to in the way that she used to. So while it's common for family members caring for a person with dementia to experience ambiguous loss, this type of grief is often not recognized or well understood by family caregivers. Very often you're busy dealing with the behavior of the person day to day, and you don't pay attention to your own feelings of what this behavior is doing to you. So what does grief look like? It's, again, it's different for each person. Each person will grieve in their own fashion. And it's important to let them grieve in their own fashion and at their own rhythm. Traditionally, healthcare professionals focus on the stress and burden of the tasks that the caregiver must undertake and pay less attention to the emotional impact of losses that the person and their entourage are experiencing. So they focus on the behavior, what to deal with, how can we help you deal with this behavior, but they don't recognize so much that, yes, this is one behavior, but there's many behaviors. As soon as this is taken care of, there'll be another behavior that we have to deal with. So very often this is where caregivers get frustrated when they're asking for help, and the social worker may say, well, what we can offer you is somebody can come in to help your mother bathe once a week. And the caregiver might say, well, that's not what I need right now. I'm stressed out, I need help. And again, the social workers are just starting to understand that this caregiver is undergoing ambiguous grief, is experiencing grief and loss over the mother that she knew. She's losing the mother that she knew. So yes, she needs help, but again, what kind of help does she need? So again, this grief and loss contributes to stress, and it needs to be acknowledged that this grief exists. And ambiguous grief can often resemble confusion, not knowing what to do, sometimes to seem paralyzed in a situation. Also, ambiguous grief can result in difficulties in making decisions, resolving problems, because it can be difficult to determine if the problem is temporary or permanent. Again, if the person is forgetting who you are, is it just for today or this week, and will the person remember you in a few hours, or is it the next stage of the disease? So again, it's this continual stress. And ambiguous also can also be difficult to manage because we don't have the customs or rituals. When somebody passes away, when somebody dies, everyone gathers around. We have these rituals. Everybody talks about the person. Everybody talks about your experiences. You have this sense of closure and support from people around you. While as when you're just a caregiver, you can be experiencing some of the same feelings, but it doesn't seem as valid. These feelings, you wonder, well, should I be feeling this way? Why am I feeling so sad? My mother is right here. So it at times it can seem unjust or unfair. And also it can last a long time. Ambiguous grief, because this uncertainty can persist and it can exhaust a person. It's just every day you don't know what's going to happen next. So normalizing and acceptance. So whether you're caring for your spouse, your parent, or a friend with dementia, the unique kinds of losses and grief that you may feel are often not recognized, acknowledged, or understood by the people around you. And if your grief isn't acknowledged or understood by others and understood by yourself, it only adds to your grief and you can feel more and more alone. Naming your feelings and talking about them with healthcare providers or some counselors at the Alzheimer Society or other caregivers going through the same experiences can help you understand these losses and grief and see that it's normal and what you're having is a valid response. You may no longer feel so alone, knowing someone is truly listening to and acknowledging your concerns. Talking with knowledgeable professionals or peers in a support group going through similar experiences can give you the opportunity to learn strategies for coping and living with the stress. This is why we want to talk about it, to normalize it, to validate it. And because you're going to have to live with it. You can't deny it. You're not going to stop feeling the losses. The losses are there. They're very real. And it's better to experience them and share the feeling. Reaching out for support in these ways can help both the caregiver and the person that you're caring for to grieve, to go through this process. Adjusting to loss and accepting the disease can help both of you move forward to make the changes needed to live as well as possible with dementia. So grieving the losses along the way. So paradoxically, healing happens when you allow yourself to feel the pain and grieve the losses along the way rather than avoiding or denying this grief. And again, I keep repeating, grieving is unique to each person. Sometimes we talk about feelers versus doers. Feelers or instrumental grievers are people that prefer to gather information. They like to be engaged in activities and projects. They like to actively organize memorials, events, while as intuitive grievers, the feelers, want to feel their grief. So they appreciate this active listening, exploring and expressing their feelings, connecting and sharing with others that are in the same boats, that are in the same situation. So I'm going to start now with the strategies, and the most important is reaching out for support. Reaching out to your circle of support. Seeking out support is one of the most positive and powerful ways of dealing with the feelings of ambiguous loss and grief that come with caregiving. There are many ways to do this. Many families are able to help and offer meaningful support to one another to cope with their losses and share their grief. Sometimes, however, they have to be going through their own grief and loss reactions and aren't able to provide the support that you may need at that time. So your circle of support may have to go beyond your biological family. It's important to reach out to individuals in your life who are your psychological family. uh, a term that means that people you naturally turn to in times of crisis and celebration. You have to identify the people in your life who are there for you in good times and bad, those individuals who may be able to understand the losses and grief that you experience, acknowledge your remarkable efforts and successes, and give vital support. And I think this is something that even caregivers don't really recognize, that basically most caregivers are doing a heck of a job. They're really getting through the day, and they're really helping the person get through each day. And as a caregiver, often they don't recognize that what a great job that they're doing. And it's important to have a connection with somebody who knows what's going on, who knows how difficult the situation is. And it helps also if you have somebody that knows your situation, like how your relationship was with the person you're caring for before the disease struck. So again, a confidant always helps. Somebody who you don't have to start from scratch to tell them your whole life story. You can just say, this is what happened today, and this is why I'm feeling so bad, so rotten today. So that's important to expand your psychological family, to recognize them. So your psychological family, it can be a really diverse group. It can include friends, neighbors, co-workers, faith leaders, and those family members who really get it. So it could be some cousins, but they understand what you're going through. The staff at an adult day program or care home can be part of it. A geriatrician or a family doctor that you have a good relationship with can become part of your circle of support through various stages of the journey, of the caregiving journey. And joining a peer support group gives you a unique opportunity to talk about feelings of ambiguous loss and grief, and share lessons learned with people going through many of the same experiences as you. So this is why we always recommend. Very often people say, well, I don't have time to do that, or I don't like sharing my personal problems with strangers. It can really help. And there are support groups now we have at the Alzheimer Society, but many organizations have support and information groups. And it does help to be able to share and to understand people are going through the same experiences. For example, with Alzheimer's, one of the issues that come up is sometimes people with dementia are resistant to bathing. So they don't want to take a shower. They don't want to take a bath anymore. And families are afraid to discuss this with others. They think they're the only ones. Oh, my father was so clean. He used to take a shower absolutely every morning. And now it's a big fight every time we want to get him to wash. But sharing this with other families and saying, oh, others are experiencing exactly the same thing. I don't have to be embarrassed about it. It's a reality, it's a fact. And how can we deal with it? We can move on. And no matter what your family situation may be, you don't have to be alone. Your circle of support can help to give you the motivation and the resilience for coping with many of the losses felt as the disease progresses, and allow you to move forward. Again, as a caregiver, you have to make many decisions every day. And if you're stuck in this grief, stuck in this sadness and loss, it's hard to make decisions. As I said, you could experience, because you're going through this grief, you could be sleeping less. Again, that would make it more difficult for you to reach decisions. And again, it's this feeling that nobody recognizes, that it's really the grief that you're feeling. It's not just the actual task. Oh, I'm going to have to get up in the morning and help my dad get dressed and then prepare his breakfast and then do all the other tasks. Yes, that's exhausting and tiring, but it's more tiring that you don't know what's going to happen the next day, that it's continual, this loss that you're feeling. Is it going to be my dad? What is he going to recognize me? What's going to happen? What loss is he going to experience today? And it's always preying on the caregiver's mind. And again, if you have the support of a psychological group, a support group, it's easier to get through, because when you say things out loud, very often you recognize what they are, and you're able to deal with them rather than just hearing them go around in your head. So we come to paradoxical thinking. How often do we hear, I have to accept that it's no longer my mom? Well, yes, but part of what makes this hard is that she's still there. She still is your mom, but it seems like she's a stranger some days. The way she's behaving, the way she's reacting to you. So again, it's this paradox. She is my mother, but is she my mother? So the ambiguous loss you feel as a caregiver is rooted in really a profound and painful paradox, an apparent contradiction that is true. The person with dementia is physically present, but often psychologically absent. So your spouse, parent, sibling, or friend with the disease is here, but unable to understand, respond, or react in the same way as they did before. So you miss them, and you grieve their ability to connect in this moment and time, this connection with you. You're losing the connection, and you have to find ways to rebuild it all the time. So paradoxical thinking is a way for you to explore and to learn to live with the many ambiguities of the disease. You may feel married and not married to your spouse with dementia. Even though a parent is always a parent, you can feel at times perhaps both like a daughter and a parent to a father or mother. You may love the family member with dementia deeply, but still feel hurt when he doesn't seem to recognize you. You want the person with dementia to live as long as possible, but at the same time, you wish for his pain to end. So these ambiguities are normal for the disease and can cause confusion. They can stir up mixed emotion and make you feel uncomfortable, maybe make you feel guilty. And again, this is a part of the disease, and you're experiencing it as a caregiver. So using paradoxical thinking as a tool can help you begin to make sense of what is happening and these complex feelings. Your goal is to learn how to recognize and understand the paradox and accept two opposing or seemingly contradictory ideas at the same time. So as the abilities of the person with dementia changes with the progression of the disease, your roles and responsibilities of a caregiver also change. So instead of holding on to the past, it's better to acknowledge the present and adapt to the changing needs of your spouse or your parent or your friend. Learning to live with these ambiguities is a balancing act. You have to get away from thinking always either or. With dementia, it's not either or, it's really both. So it's not he's here or he's not here. He is here, but part of him is not here. So that's the paradox that we're talking about. And it's important that instead of believing and feeling that either the needs of the person with dementia or your needs must be put first, you see that both sets of needs are important. And this is what we stress very often is when we're working with caregivers is it's not either or. It's not that the person with dementia's needs are more important than yours. It's that they're equally important and that you have to learn this balance. Because if you aren't balanced, if you don't keep a balance and you just, as I said, if this reciprocal relationship changes and this person becomes more and more needy, instead of give and take, it's more take on the person's part and you're give. If it becomes so out of balance, then you become unhealthy and unable to make the proper decisions, to become frozen or have this feeling of helplessness. So it's important to avoid that, to take care of yourself. The example that everyone always gives is in an airplane, if the oxygen masks fall down and you're with a young child, you don't put the oxygen mask on the young child first, you put it on yourself first and then the child. Because if you put it on the child and you pass out, how is that child going to be able to help themselves? Again, that's what it is. As a caregiver, you have to take care of yourself so that you can take care of the other person. So every person with dementia is a whole person, regardless of their abilities, and connecting with the person is still possible at all stages of the disease. And this is what you can learn. What a person says or does and how a person behaves has meaning. So it's just to figure out what this meaning is. It's just that with dementia, it affects the ability to communicate in a way that we can easily understand. So the Alzheimer's Society and healthcare providers, they can help you with this. They can give you some information. So here's another testimony from a caregiver. It's a paradox. Something is lost, but something is not lost. So I started to look for things that were still part of my mom. My mom still has a sense of humor, and I can still share a laugh with her. She still has an emotional part of her. So I zero in on the emotion of the event because that's the level where she gets it. She may not know my name, but she knows who I am. So that's recognizing, yes, it's different now, but the person is still there. She can still recognize you. And again, this is, it's to recognize that very often you're going to need help. It's hard to do this all by yourself. So that's why I do encourage you, contact the Alzheimer's Society, contact other societies, contact healthcare workers, social workers. You might say, oh, I don't need a social worker right now in my family. It's a start. It's the connection. It's the start of being able to look after yourself. So this is where we're talking about building life strategies, regardless of the grief and sorrow that you're going through. The first is really to reflect. Take the time to recognize and express your feelings. Like, why am I feeling? You feel this sadness. Why? What loss am I feeling right now? I'm feeling sorry because I know that now we'll never be able to take that cruise to Europe that we were always dreaming of. Something reminded me of that right now, and I really am grieving that loss. So it's okay to say it out loud. You're allowed to feel sad. Stay in contact. Again, it's important to speak to friends and relatives to reinforce current connections and also to be open to making new ones with people that may understand and help make your life easier. So again, I know that it's very hard because when you're a caregiver, you spend so much of your time and energy looking after the person. It's hard to go outside and make connections or to explain your situation to other people. But it's important, and you'll feel better and you'll be able to live better if you do make that effort. You have to, again, take care of your needs. You have to stay physically active. You have to eat well. You have to do whatever it takes to reduce your levels of stress. It's very important, especially in these times. You have to take care of your mental health as well. So that means sleep, getting enough rest. All these things help you to make good decisions and to be more effective in your life, in your caregiving. So you have to tell friends and relatives how they can help. You have to be specific. Very often there's a lot of people that would like to help you and they say, oh, just call me, I'd like to help you. You have to be specific. What do you need them to do? You need respite. Can they come over and sit with your dad for 2-3 hours once a week, or even once a month, to give you that time of respite where you don't have to think of your caregiving job, where you can just think of yourself? Again, that's important. Or in these times, do you need somebody to do your grocery shopping now? It's very difficult in these times. There's a lot going on. Again, if you can't leave the person that you're caring for alone, and you can't take them out in these conditions, again, ask for help, ask for specific help. And again, you can ask for help too, anywhere that you can get it. Like, don't be shy at this point. You should be informed. Again, read, ask questions, share your experiences with other people in the same situation. This will make it easier to plan for the future as well. Ask for help. Again, don't be shy to ask for help at social services. Even if you think you don't need, there's nothing that they can do for you right now. It takes time to get into the system, and it's really important to have a social worker, so she'll be able to guide you through the healthcare system. It's a very complex situation right now, and all the help that you can get, you should ask for it. And again, it's going to take time, so start now. Don't be shy. And again, by asking for help, it lets you remain more independent, more autonomous. If you want to keep the person at home, it will help you to do this for a longer period of time, but you can't do it on your own. You need help. Also, it can help you make plans for the future. Again, groups such as we have at the Alzheimer Society of Montreal can help you with this. And share your expertise. You may not recognize, but you're becoming an expert. By being a caregiver, you're learning a lot of things, and you don't realize it, but you should really share this with others. What's worked for you. It doesn't mean that it's going to work for everyone, but it can inspire someone else. And you may even want to eventually volunteer to help an organization, to help others going through these things. You have to express your grief in creative ways too, often expressing yourself through writing, painting, photography, or another form of art just helps relieve some of the stress that you may be feeling. And most important, recognize and value your personal knowledge and experience. Recognize and value your growth as a person, which resulted from caring for a person, for a family member with a neurocognitive illness. You may have learned some new skills, such as handling finances. You've probably become more compassionate, or developed an inner strength and resilience that you didn't realize that you had before. And this is what we want to do. We want to boost your resilience. The resilience is that remarkable quality that helps an individual to adapt positively to challenges and changes in life, and the losses and grief experienced in caring for a person with dementia. There is no solution. We can work towards a tolerance for the uncertainty and the ambiguity that the condition creates. So again, we want to boost resilience, take care of your own needs, the physical, emotional, social, and spiritual. So the question I'd like to leave you with is, how do you take care of yourself? How can you foster your own resilience? So I hope that this has helped you a little bit, so that you'll recognize that there are strategies that you can take. Again, recognize your grief, acknowledge it, talk about it, and ask for help, seek help. So I hope that you will follow up on this and will take care of yourself. The Alzheimer Society of Canada has put out a number of publications that you might find useful. One of them here is called Ambiguous Loss and Grief and Dementia, a resource for individuals and families. This you can get on the Alzheimer Canada site. So it's www.alzheimer.ca. You can get all kinds of information. Just look at their publications and look up Ambiguous Grief. Um, also, there's Pauline Boss has done a lot of work on ambiguous grief. She was one of the original people that coined this phrase. And again, there's a lot of information that you can get at the Alzheimer's Society of Montreal and also Alzheimer's Society of Canada. So that's our number. If there's ever any questions, just call us. Again, at the moment, our offices are closed, but all our counselors are working full time. So somebody will certainly get back to you. All you have to do is leave your name and say, you know, I need to speak to somebody, and they'll get right back to you. So if anybody has any questions now, you can ask them, I think, through Caitlin or Sarah.
Yes, if anybody has any questions, you can ask them now, or you can type them in the little chat box down below.
So everybody feels comfortable in dealing with their grief and losses.
Mm-hmm. I have a question. I actually typed it to Teresa.
Okay.
Can you look at the question, what I typed, Teresa?
Okay, I'm looking at it now.
It's about social workers, about getting the help of social workers. I think it's kind of naive to assume that it's easy to get a social worker. It's very difficult to get a social worker.
Yes.
I can get it through Alzheimer's or through you, but to get my mother a social worker to help me in my decisions for the past 3 years has been impossible, because they told me there has to be abuse or violence in the home before they can afford to give us a social worker. This is what was told to me. So I find it ironic that the more implicated I am, the more I take care of my mother, the less likely I am to get help. And this is very sad.
Yeah, it really is. And again, the social worker, it isn't easy. That's why I try and recommend that people start as early as possible, as soon as they get a diagnosis, to try and get a social worker for the person they're caring for, so that.
But then she got one. She was released from the hospital, which is when they give you one, and then they take the social worker away. They closed her file 3 years ago. She's degenerated since then. She has 1,000 more medical issues, and the file is still closed. Nothing changes. So I started when I should have 5 years ago, and it just gets worse. Nothing to say. I mean, there's very little to say.
Again, it is very difficult, and I don't deny that at all. Again, we're trying to make it a little bit better. What we're trying to do now is we're trying to train some of the social workers to recognize dementia. Again, because the system, they're stopped in a lot of ways because of the way the system is set up. But we're trying to have them recognize, like, a person-centered approach to care, to look at the whole person and not just one facet. And also we're trying to get them to acknowledge that when they are looking at somebody being a social worker to somebody with dementia, really there also have to be the social worker for the caregiver as well. So the file there has to be 2 files, not just one. Whether this is going to actually take effect, but we've been pushing for it for years. We've been advocating for it.
Yeah.
So hopefully.
Yeah, I think.
But it's better to have your name in the system than not have your name in at all.
I get your point, but the system at this point doesn't respond to the needs of caregivers.
Yeah, and I think we're gonna it's gonna be tricky over the next year or so also, because they're really in disarray right now.
Oh, well, they were in disarray before this happened, believe me.
Yeah, yeah.
I don't know how many other people live in the area of René Cassin. It's one of the most poorly served areas because of the number of seniors.
That's it.
And
Actually, they have the most funding for seniors. Other CLSCs have even less because they have perhaps a younger population in their area. It's
right.
um,
But I think there need to be, it needs to go higher up than the people in the CLSCs, because the
mhm,
people making the decisions in the CLSCs are fixed in their decisions about who needs a social worker, who requires a
yeah,
social worker, and their opinions at this point are still stuck in, the
yes,
opinion that social workers are meant for something different, not for managing the case of a 95-year-old living alone in the community.
yeah. No, and again, it's the level of bureaucracy. There's so many levels of bureaucracy. It's getting really ludicrous. But we do have a Fédération des Sociétés d'Alzheimer, um, and they advocate at the government level.
Mm.
So
Yep. That's where it needs to go.
and that's what they're doing, because we have 20 societies across the province of Quebec, and this federation is responsible for all of them. So they have a little bit more push when they go to the government rather than us going as individuals.
Right. One last thing, I'm taking too much time. The irony is we as caregivers, probably we're taking care of our parent or whoever, spouse at home, and we've saved their lives because they're not in these group homes.
Mm-hmm.
So the government should wake up and say there needs to be more support for us, because look
Yes.
what we saved in this COVID crisis. During
Mm-hmm.
this COVID crisis, it was because of what we do that we saved the
Exactly.
lives of so many of these people.
Yes. And they keep saying, well, it's good. People should stay in their homes for as long as possible, but they can't without actually having physical help in the homes. We can't expect families to do it by themselves anymore. So,
Sorry, Teresa, we have another question here. Somebody just wanted you to expand a little bit on what frozen grief means.
okay. Frozen grief is when you're really stuck in the loss. You can't move ahead. It could be that your mother that you're caring for is having difficulty preparing her breakfast when she used to, and you're seeing this, that she can't do things anymore, and you're trying to help her, but it's as if you don't know what to do next. You can't make a decision. Should you move in with her? Should she move in with you? What's going to happen now? And it just seems so overwhelming that you're frozen. You can't get over this grief, and that's why it's important to acknowledge this and talk about it with somebody. Because if you just live with it and just say, oh well, there's nothing I can do, she's getting older, I'll just have to, I'm going to try and be there for every meal time and make sure she has enough food in the house. You can do that for a short period of time, but if you keep trying to do it by yourself, it's not going to work. But again, if you talk about it to professionals or to a support group, you'll get more ideas, and you might be able to find some ways to get to the next step. Does that answer the
Yeah,
question a little bit?
yeah, absolutely. Are there any more questions for Teresa? I think we covered quite a bit today. So thank you, Teresa. That was a very informative and fantastic conference. The members of the MCSA Education Committee would like to thank you and everybody who signed in today to watch this conference. Our next event is from our fitness program with Juliana Guerrero, coming up this Thursday, July 9th. And our next conference is called Ma Génétique, Ma Santé, given by Laura Robb, next Tuesday, July 14th. And the link to all of our events has been put into the chat box, as well as a quick little survey if you guys have a moment just to answer or to give us your thoughts on today's conference. And thank you for showing up today, and we hope to see you at our next conference.
Thank you.
Thank you. Bye, everyone. Have a good day.